Hello, my name is Patricia Jeffers, and today I will be speaking to you about prompt hierarchy and how it can be incorporated into our everyday practice as behavioral health professionals. So, over the next few slides, we will be discussing what prompts are, prompt fading and levels of intrusiveness, the 7 types of prompting, and how we can incorporate or implement prompts when working with our learners. Let's begin by discussing what prompts are and how they look. Prompts are an added stimulus that help move learners from incorrect responding to correct responding. Prompting procedures provide a systematic way to teach learners to perform skills independently. As adults, we can use prompts as a specific form of assistance either before or as the learner attempts to use a skill. Prompts can be used to help teach learners skills by giving vocal instructions, visuals, and or using physical guidance. It is important to clarify that prompts have different levels of intrusiveness. Physically guiding a learner, meaning you place your hands on the learner's hands and or body through the process of teaching them a hand washing routine, is more intrusive than pointing to the sink to signal the next steps within that routine. Keep in mind, as a behavioral health provider, we want to ensure that our learners are working to engage in skills independently. We do not want them to become dependent upon our prompts to complete desired tasks. Which brings us to our next topic of prompt fading. Prompting and fading are tactics that go hand in hand when teaching learners new skills. Prompts help to ensure that the learner responds correctly, whereas fading involves reducing the prompt as the learner engages in correct responding more frequently. As previously stated, we do not want our learners to become dependent upon our prompts to complete a desired task. Considering the level of intrusiveness allows you to determine the sequence of prompts used when fading prompts. Libby et al. Discussed 2 ways in which behavioral health professionals can implement and fade prompts to help increase a learner's ability to independently complete a desired task. The first procedure is that of most to least prompting. This consists of an adult placing their hands over the learner's hands to guide the learner through the initial training trials. The amount of physical prompting is then gradually reduced as training progresses from session to session. The second procedure is that of least to most prompting. This consists of an adult allowing the learner a brief opportunity to respond independently on each training trial and then deliver the least intrusive prompting as needed. If the learner responded incorrectly, then the adult works up the prompt hierarchy until the learner demonstrates the desired skill. When implementing prompts, consider the following when selecting prompt techniques. Most to least should be used when the individual's learning history is unknown. If errors have been found to trigger problem behavior or impede learning, most to least and least to most with time delayed is preferred. Least to most is preferred when individuals show rapid skill acquisition. And lastly, progress should always be monitored to ensure errors do not impede the learning of our clients. Before implementing most to least and or least to most prompt hierarchies, professionals should probe their clients to see which type of prompt provides the learner with the least amount of assistance, more information, and the most amount of assistance. When implementing most to least or least to most procedures, there are 7 prompting steps that professionals should either work their way up or down. Remember, prompts can be given verbally, visually, and or physically. The chart provided shows the steps of implementation for least to most and most to least prompting. The direction of prompting is indicated in red on either side of the pyramid. You can see that the top of the chart is where we would like our learners to be. We want them to engage in desired behaviors or skills independently and not have to rely on someone to always guide them on what to do. If the individual is unable to perform the desired skill independently, then professionals would continue down the prompt hierarchy until they engage in the correct response. Consider the following when implementing intervention strategies. Establish the learner's attention by either saying look or saying their name. Deliver the stimulus and provide a cue. When the learners wait for the learner's response, respond to the learner's attempt. Immediately provide positive reinforcement when the learner demonstrates the desired skill. And always monitor your learner's outcomes. Now we are going to go through each prompt level and discuss different ways to implement each prompt step or level when working with your clients. For the purpose of this explanation, we will be walking through the example of teaching a client a toothbrushing routine. So for independence, the learner will independently engage in the desired skill and/or behavior. An example of this would be the learner performing their teeth brushing routine by themselves without the assistance of a technician. Visual prompting involves the use of pictures, photographs, videos, and/or other visual cues. This could look like providing the learner with a visual task list that demonstrates each step of their toothbrushing routine. Verbal prompting is when the technician provides the learner with a verbal cue. An example would be providing the learner with the verbal statement of what do you brush next in the sequence of their toothbrushing routine. Gestural prompting is any kind of gesture. An example would look like the technician pointing to the learner's toothbrush and/or their teeth to help facilitate the next steps within the routine. Modeling is when the technician demonstrates the skill first and then asks the learner to repeat the task. So an example would be the technician models each step within the toothbrushing routine for the learner and then asks the learner to repeat those steps. Partial physical prompting is when the technician provides minimal physical guidance when necessary. An example of this would be the technician touching the learner's elbow when prompting them through the steps of brushing their teeth. Full physical prompting is physically guiding the learner's hands and/or body to complete a skill. This is also known as a hand-over-hand procedure. An example would look like the technician placing their hands over the learner's hands when teaching the toothbrushing routine by physically moving the toothbrush back and forth along the individual's teeth. Thank you for joining today's training session. I hope you were better able to understand the prompt hierarchies and how to implement them into your daily practice with your clients. If you have any questions or concerns, please feel free to reach out. Thank you again for joining. Bye.